safer and healthier future. Thank you to my colleagues in Congress. It is good to be with you this morning, and it's so good to see you, Mary. It's just delighted. I want to just also take a minute to recognize all of the Granite Staters who are here today, and thank you for everything you do for our state, and for everything you have taught me and helped me do for the people of our state. It is a tremendous honor to be with all of you this morning and to receive the Community Anti-Drug Coalitions of America Congressional Leadership Award. I am proud to be your partner in the United States Senate. I will keep working every single day to try to give you and all of the heroes on the front lines of the substance misuse crisis the tools and the support that you need. When I first got to the Senate, now 2 years ago, one of my most pressing tasks was to try to convey to my colleagues the devastation that the fentanyl, heroin, and opioid crisis was inflicting on communities in New Hampshire and in states all across the country. But all of you understand that painfully well. Each of you has seen how this crisis costs lives, strains our families, and hurts the productivity of our workforce, how it undermines the safety of our communities, and how it impacts people from all walks of life. The magnitude of this crisis demands that we collaborate across traditional boundaries, taking a truly all-hands-on-deck approach that combats this challenge from all angles. That's exactly what all of you are doing. In New Hampshire and throughout the country, CADCA is helping strengthen communities by fighting to prevent alcohol, tobacco, and drug use. Your work helps break down silos, and it brings people together, people from and with each of the perspectives that we need at the table to get results, from youth, parents, and schools, to law enforcement officials, healthcare professionals, businesses, local governments, and civic groups. Together, these coalitions are implementing concentrated, coordinated, and effective strategies. You are empowering young leaders to fight for change and raise awareness. That's a good thing, yes. And because of CADCA's work, particularly through the Drug-Free Communities program, we're seeing real results. In the Granite State, there are currently 12 drug-free community coalitions that are funded through this program, including the Franklin Mayor's Drug Task Force, Salt and Light, the Raymond Coalition for Youth, and the National Prevention Coalition, which are all represented here today. And I look forward to seeing you all a little bit more later this afternoon. These community coalitions have proven to be effective. Take, for example, the All Together Coalition in Lebanon, New Hampshire. Thanks to their work, we've seen impressive outcomes in reducing levels of 30-day use of alcohol, tobacco, marijuana, and prescription drugs by 14 to 17-year-olds. This includes, and this is what's so great because the data is here to show the effectiveness of your work. This includes a 28% drop of high school youth reporting past 30 days use of alcohol, a 38.6% decrease for tobacco use, a 14.6% decrease in marijuana use, and a 62.2% decrease in prescription drug use between 2013 and 2015. Your work is making a real difference on the ground, and your work and your results prove that one of the most critical things we can do for our young people is to support prevention programs, because starting these programs early gives young people a strong foundation and helps prevent substance misuse before it even starts. Funding for the Drug-Free Communities program has seen long-standing bipartisan support as evidenced on this stage today. And I will continue working to invest in this program and ensure that you have the resources you need to support your mission. Just a couple of words on some work we've been able to do in the Senate and in the House. We took important bipartisan strides during the last Congress to strengthen our efforts to combat substance misuse. Late last year, I was privileged to be at the White House as the President signed into law the Bipartisan Support for Patients and Communities Act. This bill represented an important bipartisan step forward on our efforts to combat this crisis, including many priorities that people like you on the front lines of this crisis have told me you need to save lives. The law reauthorizes and improves state-targeted response grants